Yarmouth Board of Selectmen meeting. It's December 15th, 2020, and it's 6 p.m. And the board has been meeting in executive session, and now we're coming into public session. So once again, welcome. I need to read this notice before we begin, and this is a notice that this meeting is being convened as a remote participation meeting pursuant to Governor Baker's March 12th, 2020 order suspending certain provisions of the open meeting law, General Laws 30A, Section 18, and the Governor's March 15th, 2020 order, imposing a limitation on the number of people that may gather in one location. This meeting will be conducted by a remote participation. Specific information such as instructions and guidelines for remote participation by members of the public and or parties with a right and or a requirement to attend this meeting can be found on the town's website at www.yarmouth.ma.us. For the public portion of the meeting, members of the public who wish to participate or listen and participate in the meeting may do so by following the details outlined in the public notice. And we need a roll call vote. Notice. Tracy Post.
Aye.
Mike Stone.
Aye.
Dan Horgan.
Here.
Eric Tully.
Aye.
And the chair votes aye. So before we begin with the first item on the agenda, I'd like to ask everyone to join the board for a pledge of allegiance to the flag. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible,
Liberty and justice for all.
Okay, we are going to begin the public comment section of the agenda. I see Liz Hartsgrove is seeking recognition. I'm going to ask that we unmute Ms. Hartsgrove to speak in the public comments.
Thank you. Good evening, Board of Selectmen. Liz Hartsgrove. I am the Vice Chair of the Planning Board, and you might remember me from being a former town employee of the town of Yarmouth. I wanted to give you an update on the Planning Board's efforts with the visioning process. As you might remember, back in August, our chairwoman, Joanne Crowley, and the town planner, Kathleen Williams, went before you with a presentation to kick off the visioning process. I believe Eric and Tracy, you were on the planning board at the last time that the visioning process might have gone forward the previous time, but we're doing sort of a little differently this time, and we put together 3 different engaging workshops for the general public to participate in at various times of the days and various days of the week to accommodate various schedules in all of our stakeholders of our community. And tonight, or this afternoon, was the last of the 3. So I'm here before you to give you a little snippet of all of that. We had an attendance of an average of about 35 people in each of the visioning workshops, which was excellent. It was manageable. It was nice that we were able to get into smaller groups, into the breakout sessions. Each meeting was about 2 hours long, and we broke out into separate little groups, and each of the planning board members were facilitators and note takers as well. And we asked about the sort of SWOT analysis, traditional SWOT analysis, and trying to create an overall sense or asking of what the people's visions are for Yarmouth in general. And again, a variety of stakeholders attended, and a variety of topics were brought up. Traditional ones of town services, economic topics, housing, open space and environmental issues, infrastructure support as well. But the real main objective of it is not only this is the first step towards us creating our local comprehensive plan in the future, but it's also to assist us in the services, the town employees as well in fulfilling the mission of the selectmen and the organization. If you don't have an opportunity to listen, you can't then make alterations and be nimble in adapting. So we are moving forward with also inviting the public to now participate in a survey. The survey will be open for the remainder of this month and into January, and this is another opportunity to collect data and feedback from the community. The survey is available on the town's website under the community visioning. On the top of the page on the right hand side, second from the right, there is a tab, and you can click on that. That'll bring you up to all the information and background information on the community visioning workshops and everything that the planning board is doing. And there is a link to the survey, which also gives an opportunity for the feedback to be submitted. Once that is all then collected, the survey is available in 3 languages: English, Portuguese, and Spanish. And then we will tabulate all of that information and then continue the process as the chairwoman had presented to you back in August, where we'll be doing more specific stakeholder meetings and then formulating more of a vision and then doing additional surveys. And this is an additional year and a half worth of work before then we can present to you. So, but I am available for any questions if you have it.
Okay, Liz, thanks for the update, for the comments, and for all the work, and the other planning board members that are here. Thank you. Anyone else seeking recognition for public comments? Okay, Mr. Glenn, we're going to unmute you. You next to have the floor.
Hi, Mr. Chairman. Can you hear me?
Mr. Glenn, we can. Yes, proceed.
Okay, sorry, I was having trouble, wasn't allowing me at first. Just one thing about Liz Hartgrove's presentation. It broke up in the beginning, right when she was describing her title, or it was at least on my end. So just describing who she was. I know her, but I thought maybe other people had the same problem. But in regards to my questions, in regards to the DHI and the wastewater, I thought there were some very great questions about the Bass River, and I had included it in my question. I don't think I made it completely clear, but I don't know if you remember some years ago, and I know it was at the beginning of Dan Knapik's tenure. There was an Open Cape Summit, and they were describing, and they let you use a tool at the Barnstable County level that could get down to individual estuaries. And it got to my main point about that we could go through millions of dollars or hundreds of millions of dollars and still not solve the wastewater problem. And, some of the people brought up with the gray water and the Bass River Golf Course that we could end up putting stuff back in the Bass River. And so it just caused me to ask if we could look at, or if that still exists at the county level, where you could use that implementation tool down to the specific area and other mitigation situations that we could use to address. But it made me also think about the Dennis side of the river, that, maybe if Dennis' plan is different, are we looking at their plans in regards to how they break it down in their different phases, especially in common areas, and also Lewis Bay, our end of the town, with Barnstable? I think that was addressed a little bit, but my main concern was, are we looking at other areas to dump that gray water? I don't know if there's other town sites that we've looked at, but those were my main concerns, mainly about Bass River Golf Course. And the other thing was, have we identified how much money we would be losing in regards to Bass River? And then finally, I know there's been some discussion at the state level with the reform bill about qualified immunity. And I'm wondering if we have looked at, town council or anybody has looked at how that could affect um, local boards, elected and appointed boards. I've heard two different stories about whether that we're going to have mass resignations from boards because people don't want to affect their personal lives. So thank you for that. Liz's presentation just now was great. I've heard great things about the visioning project, and thank you for the last week's forum on the wastewater. Thanks very much, Mr. Chairman.
Thank you. We're all taking notes on your comments, and we'll follow up. Who else is seeking recognition to speak? Ms. Morris, we're going to give you the floor. Can you? Peter, you have to unmute yourself. How's she doing? She's not doing too well.
Now it's okay.
All right.
I want to go back to.
Before you begin, just state your full name and.
I'm sorry. It's Vita Morris.
Yeah.
I want to go back to last week's subject matter, the wastewater management thing, and very specifically, I think we get a little bit fuzzy when the presentation on the financing is done. I really would like to know a little bit more as to who is going to pay what. This business about the our real estate taxes of not being affected by a $130 million project, it sounds beyond the shell game to me. I really would like for somebody to lay it out a little more clearly. And because when an example was used as a portion of this financing, the newly moved part of the CPA funds would apparently, by somebody's, I guess Jeff or the consultant said that we would it would amount to about $500,000 a year. I mean, what is that in a $130 million project? I mean, what will constitute the meat of it? I understand that at almost the same time, the town of Barnstable is looking into this project, and they are definitely looking at an override of major proportions, I guess. And the other thing that struck me was that I understand that their total cost for the first phase is about $150 million. Now that is a much bigger area, and they're sewering everybody supposedly. So that's a much bigger area that has to be done than Yarmouth. So here again, why are we getting such a high cost compared to the town of Barnstable? I know they have some sewering already for business areas and what have, but still, I think it really is something that I would prefer to get a clearer idea of exactly how I thought at one point there was some talk about whether the homeowners would pay a certain amount or a percentage, and the businesses would pay a certain amount, and now we don't hear anything about any breakouts or anything like that I can remember, and it kind of upsets me. I wish we had a clearer idea of because that was obviously the thing that brought us down the last time, 9 years ago, because people realized, and apparently, according to what the Barnstable people are hearing, I mean, it's going to be very expensive to hook up, or there might be an alternative, but that's going to be even more prohibitive if you stay with the newest model of the septic systems, which apparently will cost nearly $30,000 if you want to put those in, and some more to maintain. So I just would like for us to have a little better idea of what the costs are going to be before we really sign on to this whole thing. Thank you.
Okay. I appreciate your comments. We have had a number of discussions on the financing and the impacts to taxpayers. I should also point out the town of Barnstable's comprehensive wastewater management plan is $1 billion. It's a significant difference in the overall plan for Yarmouth. Who else would like to seek recognition for public comments?
Oh, Mr. Cullen. Mr. Cullen would like.
Okay, it looks like, yeah, I just see the hand covering the camera. Mr. Cullen, would you like to speak?
Cullen.
I can't hear him.
I'm trying to ask.
Unmute. There we go. Thank you, Mark. I just wanted to make a few comments about issues on the agenda tonight.
Sure.
I sincerely hope that the Board of Health and the Board of Selectmen will make a very strong statement to we citizens over the real risk we're at now with COVID-19. We're far higher on cases. You know, we're in the red zone. It was a great discussion last night at the Board of Health meeting, but we need citizens to, I hate to say it, stay away from Christmas parties. And this really began when the weather got cooler in early November. It isn't just because of Thanksgiving, but we are in dire straits. And I hope townspeople understand that. And we need to carry out all the wisdom that everyone has to stay safe. So that was number one. I look forward to the discussion. Number two, on the regional water partnership, I hope you will vote in favor of it. And I think it was an excellent presentation discussion last week. It was very informative. This has been analyzed by a lot of people. There will always be differences of opinion, but I urge you to vote yes. And I would also say that the three-town partnership is a very excellent idea. Regional partnerships are good for the Cape, and the more we can do of them, I think the better we can for everybody that's involved. Thirdly, and the chair knows this, I hope that on the issue of the school committee vacancy, you would at least make the town council's advice public. I read what I thought were the three documents that were involved in this: the charter, the school committee's policy handbook, and the regional school agreement. And I thought the school agreement was pretty clear. Now, I know the horses left the barn, and that's fine, but I thought that was pretty black and white. So I'm trying to learn how what I saw is different than what everyone else saw. And then certainly last but not least, thank you for putting the storm alerts on the listserv. I just saw that this evening. It's excellent information, a lot of data, and I want to thank who's ever responsible for doing that as a great service to the public. So those are my comments. Thank you very, very much.
Thank you. Thank you for your comments. Okay, and since there's no one else seeking recognition for public comments, I'm going to move on to the next item on the agenda. And for this portion of the agenda, this is a change of manager item. I'm going to turn this portion over to Mr. Stone, who handles licensing matters. Mr. Stone?
Thank you, Mr. Chairman. This should be relatively brief. The change of manager is for the Yarmouth House, and the person that is going to, with the board's approval, assume that responsibility is Kerry Nielsen, who's also known as Doc Nielsen. He also right now is doing management functions at Red Face Jack's. He teaches the TIP certification course every year. He is very much involved in the annual presentations put on by the Yarmouth Restaurant Association to train servers of alcohol on issues such as how to detect false identification, how to detect people becoming inebriated and things of that nature. We have gotten a call from Tom Murphy, who's the president of the Yarmouth Restaurant Association, endorsing this change of management, and we have a letter from Bill Magnuson, who praises him for his involvement in the things that I just mentioned, and feels that because the businesses are very close together, he sees no impediment to him taking on this additional management responsibility at the Yarmouth House. He says they are in close proximity, and Doc tells me that he is at both establishments on a near daily basis. I believe he has the capacity to handle the statutory duties of manager at both in compliance with our regulations. Those are Officer Magnuson's words, who's the alcohol liaison for the Yarmouth Police Department. So I see that Doc was on here earlier. I don't know if he still is. Yes, he is.
Yeah.
I don't know if there's anything he would like to add.
He's unmuted.
No, everything sounded good that was said. That's great. I also have, we have cameras at both places and they're on my phone. So if I'm at one place, I can check on the other place by being, just going on my phone and checking the cameras there. So it works out pretty good. And I've actually been doing it for the last few months already anyways. We were going to do this in March, but because of COVID, we got pushed off.
So, Mr. Chairman, I would like to have a motion to approve that change of management if no one has any further questions.
I do have one question, if I could.
Yes.
Is there a precedent that we have one person managing more than one facility in town?
I'm not aware of any. They're under the same ownership, I believe, and they are in close proximity to each other. And this person is someone who actually trains the servers in the area as to how they should be vigilant in exercising their responsibilities in the service of alcohol. So I don't recall us ever having anyone with those qualifications that was to be a manager.
I'm just concerned about, I imagine the idea of having a certified manager on site has merit in terms of having an actual body there, and how that absence will be dealt with somebody that's trying to be in two places at once.
Doc, do you want to comment on that?
Well, it's less than it's like a mile away from each other. It's they go back and forth all day long as it is now, and I really don't see a problem in it with what I've been doing in both places.
Did it's not officer, it's Attorney Magnuson, did he proffer any kind of recommendation in this instance, Mike?
He did. He recommends that he be approved.
Okay.
He says, quote, "The fact that he is also manager of Red Face Jacks is not an impediment to taking on manager responsibilities at the Yarmouth House," close quote. And then he goes on to say how they're in close proximity, and Doc is at both on a nearly daily basis, and he believes he has the capacity to handle the statutory duties of manager at both sites in compliance with our regulations.
Forgive me, I don't know Doc Nealon. Is there any indications in the past that there have been issues?
With him?
Yes.
No, quite to the contrary. He has been a leader in our alcohol education approach to avoiding liquor violations. He participates in the annual seminars that we've had up until this year to teach the servers the pitfalls, the dangers, the concerns, things that may happen that can cause liability criminally and civilly. He also teaches the tip certification courses. He's one of the people that certifies the various servers in restaurants and in bars. He actually trains them.
Be 6 years coming up this year of doing this.
Will there be somebody on site that will have the responsibility or the capacity to act in your absence?
Oh, yes, for sure, because we have to send in to the other managers have to be sent to Linda Hill, so she has the people's names as the backup managers. So there's always somebody there, and they've all been trained by me also, because everyone has to take the tips training.
Thank you, Mr. Nealon. Thank you, Chairman
Thank you.
Stone.
Make a motion, we approve the change of manager.
I'll second it.
Okay, I guess we have to have a roll call vote.
Correct.
Mark,
Aye.
Tracy,
Aye.
Dan,
No.
Eric.
Aye.
I vote aye as well, so that passes by a vote of 4-1.
Very
Thank
good.
you, Mr. Chairman.
Thank you, Mike. The next item on the agenda is an update. We've asked the Board of Health to come before the board and to update us on the latest developments with respect to COVID-19. And as everyone knows, a growing concern here in Yarmouth. So I see Bruce Murphy is here. I'm going to turn the floor over to our Health Director, Mr. Murphy, to. I'm sorry? And we need to find the chair of the board. He's there. All right, but both of you, Hillard and Bruce, have been unmuted, and we're going to turn the floor over to you.
Thank you, Mr. Chairman and Board of Selectmen, for inviting myself as Director of Health and the Board of Health to tonight's meeting to give you an update on the coronavirus. We have some slides that were in your packet, and I've updated a little bit, but this will help update the board and the general public. I will make a presentation, and the chairman of the board has a few comments as we go through. We do have other board members that are on the meeting also. So with that, we'll move right along to what we have in town right now for coronavirus cases. You can see from the beginning of March 11th, we've had 463 cases. We currently have 89 active cases. That was as of 2 o'clock this afternoon. We received 2 more, so we're really up to 91 active cases within the community. We've had 6 deaths. We've had 3 deaths in the last week, 7 days. As you can see, as we go down, the 91 positive cases that we have right now have been spread with the total that we've had so far of 463 cases is spread throughout the town, that's why we call it community spread. As you can see, West Yarmouth 197, South Yarmouth 182, Yarmouth 484, probably based on a little population where we have it also. Also, we're now starting to see some of our active cases appear at the nursing homes, long-term care, and a couple other facilities in town. So as we can see the increase in cases here, that started in March 11th, which went through March, April, May. You can see the spike. Then it went to the summer, not many cases. Everybody's outside, more social distancing. Matter of fact, we went through July and August, a period of time of 21 days without any cases. And then we had a few days where there was only 1 or 2 cases. And then we get back into November, and then you can just see it's taken right off again. So if you looked at November, when we looked at just the month of November, no, go back, stay on that chart. Just in the month of November, we had 138 cases. If we look at the first 3 months that we had from March to June 1st, we only had 119 cases. So you can see quite a difference that we've had just in the 1 month of November took the same as the first 3 months. If we look into December, just the first 15 days in December, we've had 139 cases. In the last, in 8 days within this month, we're over double digits in cases. So you can see the cases are even increasing over the 1 month we had in November right up to December. Okay, we can go to the next chart, shows the daily cases. This is something the chairman monitors, that we can try to look at the cases that come in each day. So I just wanted to show you that's one other area that we look at and we're tracing. If we go to the next chart, we also break it down by age since the beginning, and we can see that the age is increasing, and we can just see the age category of the 20 to 39 age group is now really have caught right up of 70, 72. It used to be a higher in the other age group, which is the 50 to 70. But you can see really right now that younger age group, a lot of the working area, families that have kids in school has really increased in town. And that's even increased from these are the stats from last Thursday to just Tuesday. You can see how they've increased in just 4 or 5 days. We're also seeing the cases earlier in age from 0 to 10, now up to 20 children, and 11 to 19 up to 29. So we're seeing it in the younger area children also. Interesting breakdown between male and females down the bottom here. Females have been more positive cases as we've gone forward, pretty much steady the whole time on the females. I would like to say on the stats that we keep going, the assistant inspector, Phil Renault, tracks this every single day, 7 days a week, checks in at night to see what we have coming in through positive cases through the state reporting system. Anything that's school age, that night we will call the school nurse to make sure that they're aware, and we can start getting the school notified if we believe the children's are in school. So that's going on, and then he works daily with the VNA and state contact tracers on data, who's on positive and who's coming off. We keep the fire and police department aware of addresses only of where the cases are in town. But as you saw earlier, it is community spread throughout the town and by different ages. We work closely with the school, as I mentioned, working with the nurse if we have to call that night. It's not uncommon to be talking to the nurse at night or over the weekend to check seating schedules, bus schedules, and so forth. I've stayed in contact with the school's athletic director, principals, especially with the new sports winter season 1 coming into going forward, basketball and hockey. I have visited the school during tryouts. The basketball all does wear masks. They're going to have the only home team can have their parents there. There's no visitors. They're trying to control it as much as they can. We'll work closely in the schools. And as of now, there's no clusters in the schools. We do have some cases between teachers and students, but no excessive clusters at this time. This chart, go back. Nope, stay with this red chart. Thank you, Pat. It just shows you the town that are in red, the high-risk categories. Barnstable, that's been there 3 to 4 weeks. Howard, and then Yarmouth moving up last week. Excuse me. And these numbers are a little lower because they were based on last week's information. I think at this time, you can see in this column, the total tests that we've had over just the last 2 weeks is 2,400 tests. So we're testing about 1,200 residents per week. A lot of that is healthcare workers that are getting tested weekly. So we see that. And I'm going to just defer this part to the percent positivity to the chairman to go over this. Hillett?
Yeah, I really think that's the statistic to focus on. And the positivity rate really is an indication of the severity of the situation. In other words, our positivity rate is going up because the infection is spreading. So I just looking at positives, I don't think is as helpful. In other words, for an example, if we had 100 people get tested in May and 3 people were positive, and now we had 100 people tested and 30 are positive, obviously the positivity rate is up significantly. And what's surprising or is essential to pay attention to is the positivity rate is going up despite increased testing, meaning there are many, many more people getting tested who are negative. In other words, they have symptoms that are not consistent with COVID-19, or they may be asymptomatic, or they're just getting tested for traveling purposes. So there are many people who can get tested now who are negative. And so you would think maybe the positivity rate would actually drift down to some point. It's doing just the opposite. So that's the number we need to pay attention to. And as you can see, the Yarmouth positivity rate is higher than the Barnstable County is right now. Thank
you. I think the next chart, we talk about a little positivity a little bit more. If you could go down. You can see we've been tracking this since March, but we've kind of broke it out since August 12th, the first week, and Hillett can pick up on the positivity rate. In August, Yarmouth was down to 0.84, and now as we go to the end, you can see Yarmouth up at 5, and the positivity rate shot really up in November, which put us, Yarmouth, higher than Barnstable and the state. So I think that's, if you wanted any other comments on that, Mr. Chair.
Yeah, once again, increased testing, you're going to have increased results. So, and that means more positives as well as more negatives. So once again, focus on the positivity rate. That's really what we need to be focusing on.
Okay, thank you. So what steps have been taken that as we move into a red high-risk community? The governor issued new order number 57 that became effective Sunday, December 13th. And that was an order across the whole state where there was a rollback to phase 3, step 1. So it wasn't just the red communities, it was the whole state rolling back. So you can see what some of the areas that were rolled back, capacity inside was reduced to several places from 50 to 40%. In the gyms, health clubs, retail, offices, places of worship. Restaurants have reduced their seating from 10 back to 6, which they had. Also, 90 minutes at a location and prohibiting music performances. We've worked with the Chamber of Commerce, who put out a notice to all their businesses to make sure the education part went out and they were aware of it. So we did visit a few restaurants and called a few, so everybody knew about the new governor's orders. So what precautions can people take that we've been stressing pretty much the whole time? Even more so now is avoiding gatherings, avoiding dinner parties, birthday parties, sleepovers, play dates, whether they're indoors or outdoors, is important. Avoiding carpools unless family members, if not, wearing a mask. Whether people are going to different areas or bringing kids to different sports, it's important to stay safe and put a mask on. If you don't feel well or are waiting for test results, don't go to work or go to school. We've had several positive cases come back that we found out afterwards they went to work or school where they were waiting for test results. So we try to keep stressing, if you're not feeling well, going to get tested, wait till the results come back before you go out, which is important to stop the spread. And we just remember people to mask up, the social distance, and wash your hands. As we move forward, I just wanted to touch a little bit. We've been getting calls on vaccine distribution from the governor. That's coming out. And if we go to the next page, you'll see the governor is really making the order of distribution. It's not the local board of health. The governor's, as probably everybody knows by reading in the paper now, we're into what we would call phase one, getting it out to healthcare workers, the vaccines being delivered to Cape Cod Hospital, Falmouth Hospital, to get out into the community so they can issue it to healthcare workers as they then work into, within phase one, the long-term facilities, including police, fire, and emergency services. So that's going to be the most of where the vaccine goes, the first phase. They hope to get that through February. Then they go down to phase two, individuals that have complications that will be going out, teachers, adults over 65, and then they hope to, by April and June, get it out to the general public. So at that point in time, the vaccine will be more than likely available within the pharmacies that are offering flu shots now, which is still important to get. So that's why it'll be getting out to the general public. We've had discussions with the county health department on possible larger regional clinics set up also. So that's what we're looking at. Updates and statistics. The Board of Health continues to put information up on the town website. That also directs you to the Board of Health information that we can put some of these stats up there. We know a lot of people want to hear what's going around on the town, whether it's community spread or we're seeing clusters. Right now, it's mainly community spread. I've been doing some code red calls in the community the last couple of weeks to keep people updated. We're putting information up on Channel 18 as much as we can on do's and don'ts. We're also putting it up in a couple different languages. We've worked with the town of Barnstable on a shared case we had with a church that had some positive cases in both communities. We have it up on our town Facebook page, and we've just recently put it up on YouTube by making two informational educational videos. One was the last week before, and then one was last week. I had met with the first one, update one, with the director of libraries, Jane Kane, and then last week with Diane Kane up at the seniors, that besides giving the stats, what they're still doing as town departments to reach out to the community and keep going. And I would say that our update that was posted yesterday has already had 247 views. So I think that's important that we are reaching out in the community, and we're hoping to continue to do that. And we're hoping to get out to the food pantry this week, so see what they're planning to do right there. At the Board of Health meeting last night, the board reviewed the memo from the town administrator recommending temporary closure of town-owned buildings to the public with the increase in positivity rates and positive cases within the community. And at that time last night, the board moved to recommend supporting the town administrator's recommendation to the Board of Selectmen. So, Mr. Chairman, Hillard, would you like to add anything else? That kind of concludes my overview, but would be open for questions.
That's great, Bruce. Thanks. We're just really fortunate to have Bruce as the director of the health department during this devastating pandemic. He's worked here for 40 years in public health. Bruce, Board of Health, we've followed the COVID-19 guidelines, those that have been issued by the CDC, the Center of Disease Control, and the governor. So we welcome your support in our efforts to protect the health of the residents. Your board voted not to enforce Governor Baker's orders during the pandemic, and this created confusion among our already struggling business owners and resulted in state inspections and violations. So perhaps your board will reconsider this decision. I hope so. I know, Eric, you had submitted some questions about COVID-19 statistics. Were they answered tonight?
For the most part, I think they were. Thank you.
And
I also want to clarify that I don't think our actions were the state inspections were not the result of our actions. I don't believe that's true.
Yeah, if I could, what I'd like to do, Hillard, is there anything else you want to present to the board tonight? I mean, we're anxious to get an update from you, and I appreciate that, and appreciate your recommendations. What I'd like to do is to go around the board and ask if they have any questions of Bruce and you, and sort of see if we can continue this dialogue. Unless there are any other questions, let me, or comments, Hillard, let me just go around to the board to see if other members have a comment. I'm going to start with Dan Horgan. Any questions for Bruce or Hillard?
Yes, thank you, Mr. Chairman. First of all, Mr. Murphy and Mr. Bosky, I want to thank you so much for the great deal of work that you've done trying to keep all of Yarmouth citizens safe. Mr. Murphy, you've done an outstanding job getting the information out, the calls particularly. I appreciate so much each week hearing about the numbers, about how serious this virus is and how to stay safe. And it seems to me that you've done a fantastic job with the backing of the Board of Health. Really, really appreciate everything that's been done to keep our citizens safe. Am I correct that the Health Department and the Board of Health have no jurisdiction at all over the schools?
That's correct. That issue comes up usually twice a week with our state meetings with the Department of Health, and the advices work with your school systems, so we don't have really the authority to oversee them.
I guess I have one concern, and it's the winter sports. Given the environment that we're in right now, it seems somewhat questionable to be going forward with sports like basketball that are close contact sports. I realize you can't make the schools do anything, but have you offered any advice in terms of the advisability of sports in the winter going forward?
Yes, we have. We still, even though the schools come under the Department of Education, we do work with them closely. We have talked to the athletic director and administration. We recommended a COVID monitor to be at the practices and at the games, so the kids make sure they're keeping their mask on, because it's hard for the coaches to watch that. Making sure when the parents come in, there's social distancing up in the stands. But the basketball's tough. They're all close together. They're playing with the ball. They're close, and it's really still under review how the seasons are going to go. How the season's going to go forward. I know there's some discussions with other towns, schools, and some of the schools have decided not to go forward with athletics. So for the winter. So I know that's still under discussion right now. Games and practices and games don't start till after the first of the year. So they'll be watching closely what the numbers are, and then watching that closely.
Okay, thank you. I'm just concerned. It seems inadvisable at this point in time, but it seems like you've got a close eye on it.
Yes.
Thank you.
Any other questions, Dan?
No, all set.
Okay, that's great. I'm going to go to Mike Stone next.
Thanks. Just a comment, really. It's the rate of infection that we see in the month of November and the first half of this month is really alarming, and greater really than the onset of the virus back in the wintertime, significantly so. I would assume that a lot of that is due to the fact that we're into the quote indoor season. Well, you know, people maybe were cheating in the good weather months, but they could maybe get away with it because they were outdoors and in a healthier environment, where the germs didn't probably congregate like they do indoors. And while people with their activities naturally are probably spaced out more. But it's you know, every time I get a daily report from Dan, we used to get a couple cases, 3 cases. A big day might be 4 cases. Now we're seeing 7 cases, 10 cases in a single day. I would think that the weather and being indoors has part of it. And I think there's probably also a fatigue factor that people are just, it's gone on for so long that they just are tired of being separated from the things they like to do. And they're growing weary of being separated from family and things like that. And they get a little careless about the social distancing and masks and things like that they were more conscious of when the threat was a newer thing. But it's problematic. I think ultimately the only real solution is going to be wide distribution of that vaccine, and I hope it happens as soon as they say it is going to happen. In the meantime, you know, you can only try to encourage people to follow the precautions of masks, social distancing, and not being involved in large crowds and parties. Unfortunately, we're in the season where that typically happens, where people go to a lot of gatherings, Christmas parties, and things like that. So I'm hoping that they're going to be listening and they're going to be aware of the seriousness of this threat. But that remains to be seen.
Thank you, Mike. Tracy, do you have any questions, comments?
I do. Thank you, Dr. Vosky and Bruce, for all your work on this. I know it's probably been in all of the 40 years that Dr. Vosky talked about. I'm sure that this has probably been the most difficult for you. I just want to talk, you know, the fact that we lost 3 lives this week is extremely saddening and unfortunate. And 3 in 1 week when we've had a total of 6 through the entire pandemic is alarming. Is there anything you can talk about that in terms of their age, underlying conditions, or are we still, you know, the one thing that wasn't mentioned at all tonight was the hospitalization. And from what I'm understanding, although our percentages are up, we're not overwhelming the hospitals. Perhaps there's a better trajectory of care that's going on now. I'm just curious how that plays into it and what you're seeing with the hospitalizations and anything about the deaths that you can tell us about.
Well, right now the hospital here has done fairly well in sense of occupancy. You know, Bruce and I spoke about this way back in April, and the concern is Yarmouth is really dependent upon one hospital here. It's not a major academic institution, so they have major programs and training, whether it's respiratory therapists, nurses, doctors, physician assistants, and so on. So there's a limit in sense of employees at the hospital, and that's our biggest concern. In that we're isolated here, we're connected to the mainland by bridges, very different than the rest of the state. But so far, the rates have been okay. You've been hearing from the governor. If the hospitals are filling up, I'm sure we're going to expect more restrictions, but that certainly has not been the case here. I don't know the specific ages. Do you, Bruce, this week, of those 3 individuals who passed away?
Yes. They were age 60 68, 78, and 95.
If I could make one other comment, maybe it's really what Michael had said, in that just the fatigue, people getting tired of all the precautionary measures that are needed. And just be aware that the vaccine that's coming is not going to answer everything in a rapid sense by the spring. It doesn't seem to be working that way. That the vaccine that's currently being administered at the hospital, it's about a 95% chance that someone won't feel sick. That doesn't mean they're not going to be infected. And that's important to understand that. So a person who's vaccinated may not feel sick, but they do have the virus, and we don't know how much they can transmit it to another person. So the expectation is that we're all going to be wearing masks after we're vaccinated. So we don't have more information than that. That's just the one from Pfizer that's being administered right now.
That's interesting. I often wondered, I was watching a program about the vaccination, and folks that have already had been positively diagnosed with COVID are also getting the vaccination. So has there been a tie-in now at this point that there's multiple strains and you could become infected again? It's
not known yet. I mean, that could be awful if that happens. So far, this virus doesn't seem to be mutating. It's similar to the flu that we get every year here, which is a similar type of virus, and we are getting vaccinated every year because the virus keeps changing. That's not been the case yet, and hopefully it doesn't occur.
So one of the things I wanted to talk about was the schools, as Mike had brought up. There was a memo that was put out by the district yesterday. They will be learning in person today, which is 12:15, tomorrow 12:16, and then they'll go online from there for a few days, and they won't return to in-school until January 4th. So that's the school district's plan at this point in time. They were talking about community spread. As far as the congregate living, that's one thing that you said you started to see a little bit of that. That's very concerning based on what we've seen in a lot of off-Cape facilities and what occurred maybe in Brewster. So are you comfortable that these facilities have that under control at this point in time?
At this time, yes. What we found out is some of them, we had a positive worker, and they had to test the facility under DPH guidelines. And when they did pick up asymptomatic people that were healthy. And it could have been one person was asymptomatic and their roommate was negative. So it was hard to say. So they're getting tested, these facilities, twice a week now. So that's another reason you see the increase in testing within town. Most of the facilities do not have visitors. They've stopped visitors. So they are taking all their precautions. They're working very hard at it. They check their staff every morning. Some of them take temperature checks. They talk to each of the staff. Some of them have broken up their kitchen staff in different shifts, so that if they lose a couple, they can still continue the meals. So they're working very hard at it, but it's the same thing as they're safe within the facility, but they have so many people coming and going that they need to monitor them also.
Well, it's great to hear that they're testing twice a week. I think that we're making progress on that with the new addition of the Melody Tent and the fairgrounds. But I think it's extremely important that we add testing, because it's been extremely difficult for people to find a place to get tested and timely results. And as those progress, I mean, I heard of somebody who got results for a regular PCR test within 24 hours this week. So I think that in terms of stopping the spread, the only way we're going to do it is to have easy access to testing with rapid results. And I don't mean the antibody, the rapid test. I mean a quicker turnaround. So the one thing I have to say about the recommendations with the town hall, I think Dan maybe should discuss his memo that was discussed at the Board of Health and the rationale behind that. I know the town has spent an extreme amount of money, and we were closed to the public for quite a period of time, and we put a lot of precautions in place with the plexiglass and the spacing, and I believe we're following the governor's protocols in terms of percentage of people in the building. So I just feel like we need to be consistent with the recommendations and what we're doing. So maybe Dan could talk to I don't think the public understands what his request was, and I think it's important for them to hear that.
If I could right now, what I'd like to do is get through the Q&A with the Board of Health, and then once we wrap that up, is maybe end on the discussion about the memo and the recommendations of Dan.
Oh, okay. I thought that's what we just.
Okay, no, we'll get there. I just want to make sure that Eric has a chance to ask some questions as well. Tracy, do you have any more questions?
No, that's it for now. I think the only other point is we do get emails from the Barnstable County that you had mentioned, barnstable.county.org. I think that's a great resource. They had a lot of the facilities for testing and just a bunch of information for the public. So Barnstable County, I think it's barnstable.countyhealth.org, perhaps. But if you Google Barnstable County Health, all the listing of the times and what's necessary for different testing and the facilities available are all there.
That's great. Thanks for pointing that out, Tracy. That's very helpful. Eric, would you have any concerns or questions?
No, I'd just like to take the opportunity to thank Bruce and Dr. Bosky and the entire Board of Health for remaining diligent during this time. I think that it is probably an enormous task to keep up with what seems like an endless stream of communication and ever-changing restrictions and guidelines coming from the state. So thank you very much for taking that on. I would like to say that I do to some extent agree with Mike with his fatigue comment. I think that given the fact that the weather is no longer conducive to being outdoors, you combine that with the holidays and people's inclination to attend gatherings and parties, it kind of creates for a unique situation. And just like to remind people that you need to remain diligent and hopefully we will all get through this at some point. That's all I have. Thank you.
Thanks, Eric. What I'd like to do at this point is shift the discussion specifically to Dan's memo. I'd like to give Dan the floor to talk a little bit about his recommendations, and then have the board respond to Dan with some questions. And then
thank you, Mr. Chairman.
Some sense of consensus on this for tonight.
Yeah. To Selectman Post's point, we did spend a lot of money, for lack of a better phrase, hardening up the facility. And I think we've done a really good job here at Town Hall since July 14th, roughly, when we went live with opening. We see on a consistent basis, even through the voting registration period, somewhere between 30 and 60 visitors a day. And to the most part, I would say that they're respectful of the conditions that we have to enter the building, and all that has been good. And we have spent a fair sum of money protecting our people with the sanitization, personal protective equipment, the cleaning contract. During voting, we saw dozens and dozens of people come through the door, and we were good. The Board of Selectmen meetings were held from mid-July on in person, and I think we did a good job there as well. And as long as we weren't in the red zone, I was very comfortable. And, we had a number of conversations with the staff, and I spoke to the Director Murphy about this, that as long as we continue to abide by the protocols and monitor the situation, we were in good shape. But I also did open the door to the point that if our situation changes, then we should be prepared to respond to that. So I think you saw in the statistics that we have rather rapidly, we have gone to this significant category of red. And I was, when you're a red community, the CEO of the community is asked to participate on a conference call with the state. And the state had asked for Monday for that call, and they gathered together representatives from the state police, from the State Department of Health, Department of Labor, ABCC, Administration and Finance. And I think what you get from that type of briefing is how incredibly serious the Commonwealth is taking this particular topic. And to Selectman Post's point, yeah, very rapidly we lost 3 members of the community, and that is very sad and very tragic to say. And you know, having known a number of people that have succumbed to COVID-19 personally, I have always taken this topic incredibly serious. So that being said, one of the things that you know, the rollback that the governor recently announced, and also the messaging that we get from being a red community, is to the extent possible, try to have your folks in town to keep them safe, limit unnecessary travel. It's kind of like setting the clock back to early March and April. And then when I look at why people are coming to town hall, in all the resources that we've invested to provide folks an opportunity to either call us to do business, or to do a Dropbox, or to interact with us electronically, the vast majority of activities that go on, if you're keeping with the idea that are they unnecessarily coming to town hall, I would say the vast majority of those instances you could categorize in that fashion. So when I took a look at that, and I'm also coupled with the fact that our workforce here in town hall is very experienced, if you will. We are in that demographic by those numbers that if you look at us in the 50 to 70 bracket, probably the majority of our workforce in town hall is in that bracket. I think there's some legitimate concern, and you couple that with everybody traveling around, and there was a fair amount of out-of-state travel, despite everybody's orders to stay at home and whatnot. And we know just by the numbers that people were getting a pretty good dose of exposure. I think there's a certain amount of angst, if you will, amongst a lot of staff members. You've got a lot of kids coming home from college, and we do know that to some degree that high teen and 20-something set is an issue and a challenge. And I think for the foreseeable future, while we're in the red zone, it makes some sense for us to continue to transact with the public as we were prior to July 14th, and also be available on an appointment basis. But I personally, on behalf of the staff, don't see the need to keep the door open. And I would point out that we're one of the very few communities that did open up and are still open to the public, when most of our peer communities have all closed since the beginning. So if anybody has any questions, I'll gladly answer that.
That's great. Thank you, Dan. Tracy, did you have any follow-up questions? I'll start off with you. Tracy, can you hear me?
She's muted.
Tracy, somehow you're muted.
You can't unmute yourself, apparently.
Right. Okay, thank you. I was trying to unmute myself. My question is basically, what does that mean? Does the work staff still report on a daily basis, or are they working remotely? How does that work?
Yeah, so as you know, because we're still under a state of emergency, we have that situation with one of the collective bargaining groups, in that if work can be done at home, it needs to be accommodated for such. And there is a portion of that collective bargaining group that is required to be at their workstations. I can tell you that the vast majority of the membership comes to the building every day, and I would anticipate that that would continue.
Okay, is that it, Tracy?
Yes.
Okay. Dan Horgan.
And how many people would you estimate are actually working from home?
I would say probably on any given day, it's less than 10% of our entire workforce.
Which equates to what?
Well, maybe a number of maybe somewhere between 20 and 25. We still have some folks on furlough with the libraries and Council on Aging as well, because Council on Aging has been closed since the beginning, and libraries recently went to curbside. So,
are there any kind of reports that they're required to fill out in terms of work that they're performing while at home?
They as part of the settlement agreement we had with the collective bargaining unit, we have a what's referred to as a work plan, that they have to work to the plan according to the plan put together by the direct supervisor. So the department heads were responsible recently to get out to the workforce an updated work plan in the event that we have to go to a more significant remote workforce environment. But the overarching condition is if it's work that has to be done here at Town Hall, they are required to come to work. If there's work that can be done at home, the settlement agreement allows them to address that at home. So it's not like an easy yes or no type of answer to that question.
Last question is everything that is capable of being done at the town buildings accommodated either through an appointment or a computer transaction or phone transaction?
Yeah, so I will, like I've said this in the past, we have an exceptional staff here, from the managers all the way to the rank and file, and customer service has always been a tremendous point of pride amongst the staff. And every day there's examples of people going above and beyond. So the plan would be to communicate to the public that though the open walk-in to the public is proposed to be closed, that appointment is also available. You just have to contact the appropriate department in advance, that's all. And we would make arrangements for a safe location for that contact to occur. Many of the builders, plumbers and electricians and whatnot, they have some, and then septic related activities occur that they need to have some more specific time, and it's that kind of work is better facilitated by a face-to-face type of conversation.
Thank you, Mr. Chairman.
You're welcome. Eric?
I don't have anything else. Thank you.
Okay. Mike?
I've heard that other towns have some kind of a fog vapor that they use to sanitize the municipal facilities with overnight, and that's better than just having the regular maintenance crews come in. Do you know anything about that, and whether there's any truth to that?
I can tell you just from our own personal experience with fogging caused a problem for us on electronics. It gummed up a lot of the keyboards. I can tell you that typically, like after the election process and in a Board of Selectmen meeting, we would have as a preventive activity, a fogging activity go on. To the point as to, what degree is that fogging actually a worthwhile endeavor, I would defer to Dr. Bosky on this, but from what I've picked up is the problem continues to be the air-to-air contact that people have from respiratory particulates as opposed to surface contacts. On our daily clean, we have a new contract for cleaning that went into place. And as part of that daily cleaning contract, high contact surfaces are disinfected, like knobs and handrails and things of that nature. And as needed or on demand, we can call in that fogging activity. But just to start spraying disinfecting fog around, I would question its effectiveness if I would, from what I've seen. And then, like I said, it did cause some significant amount of damage to our electronic systems.
Well, that's not good. Mike? Any other comments, questions?
I have a couple more, sorry.
Okay.
We're coming up on license renewal time.
Yep.
How are you? There's a lot of renewals at the end of the year, I think.
They're typically done by mail transaction, electronic transaction.
They all are. Okay, that's what. And I know the last time we entered into this phase and we did that, there was a lot of coordination. I'm very conscientious and sensitive and worried about our elderly population. And I'm hopeful that the connections that were being made with the senior services the last time with the outreach is going to continue this time if they can't come into the buildings.
It still goes on. Diane Kane has done incredible work. She She's very much silent. She doesn't get the recognition that she probably should as it relates to that topic, but she continues to service the needs of our most needy elderly, and including the daily lunch program. And the entire staff over at the Council on Aging has done an absolutely tremendous job taking care of our population. And I like I said, I think if there's an unsung hero in town, clearly that staff there and the staff at the DY schools as it relates to the meals that are performed for the community on an everyday basis. That is a Herculean effort that they do, and they do a great job. So I'm confident that if we can reach somebody, our staff has reached them and we're taking care of them. It's typically people that have fallen through the cracks or did not reach out that we sometimes have some challenges with, but we end up catching up to them eventually.
And my last comment is about voicemail. Are our employees able to and required to check their voicemails from home? The reason I ask that is because there's so much electronic interaction, whether it's licenses and email. We have a population also that it has a difficult time with that, so they'll call.
We're very sensitive to that. And I would say we had a glitch about a month ago. We had a voicemail software upgrade that glitched us a bit. But the customer service facing departments do an excellent job, and they generally know their population well and make contact. So I feel pretty confident that across the town that if somebody were to leave a message, it gets answered.
Okay, I just hope that that's done, because I think they get nervous
Understood.
when they can't accomplish something and they can't walk in and talk to somebody face to face. I just hope that if the building itself is closed and they don't have access to a computer, that a telephone call.
We would always accommodate that. There's no question about that. Yeah.
Thank you.
That's great. What I'd like to do is I think it would be helpful for the board to make an endorsement of the recommendations here. Is there anybody that would have an objection or concern about doing that? Okay, that's helpful to know, because obviously we're in the red zone, as they say, but not in a good way, but in a negative way. I think my own observation is I think these measures that are being recommended are necessary. We took measures involving the library at our last meeting. I think this makes all the sense in the world. So I would welcome a motion to endorse the recommendations in the town administrator's memo to the board.
I'd make that motion, Mr. Chairman.
Do I have a second?
Second.
Is there any discussion? Hearing none, I guess I have to do a roll call vote. Tracy Post?
Aye.
Dan Horgan?
Aye.
Mike Stone? Eric?
Aye.
And the chair votes aye. The endorsement of the recommendations carries unanimously.
Thank you.
Thank you. And again, thank you to our Board of Health. You, as other board members have said, you've done a great job, and I would agree. Bruce Murphy has been incredible during this effort, and once again, we want to thank Bruce for all of his hard work on behalf of the town, the community, and for the board. So thank you. So we're going to move on from this item on the agenda, and we're going to take up the next item, which is the DHY agreement. And I think for discussion and vote, I think the first thing that I'd like to put out for discussion is, first of all, we have Dave Young here, Jeff Colby is here. Before we discuss whether or not we're going to endorse this and put this on the town meeting warrant, I just want to check to see if other board members have questions that they'd like further clarity or clarification on with respect to the agreement and to this partnership. Eric, I don't see you, Eric. Do you have any questions?
No.
No, okay. So then what I'd like to put out then is to see if we can have a motion to endorse the DHY agreement as drafted and to place it on the warrant for the annual town meeting. Someone
Chairman, I make that motion.
Mr. Horgan makes the motion. Do we have a second?
I'll second it for discussion. I do have a question, a couple questions. Sorry.
Okay. So we have a motion and a second. I'm going to go to you, Tracy. What's
Yeah, I just, I just want to be clear that if one town, this doesn't pass at town meeting, that we have the opportunity, so the agreement would be no good, basically. We would start over, correct? I just want to make sure that we don't support this, enter into it thinking we're going with a 3-town and then we end up with a 2-town. I just want to be clear about that.
Well, that's what this is. That's my understanding. This is a DHY agreement. This is the 3 towns working together in partnership. I think that's what we've been discussing all along. That's the way the costs have been laid out. That's the way the board membership has been laid out, or the commissioners have been laid out. So it's all laid out with the 3 of us. That's my understanding. Am I incorrect on that, Dan?
No, that's my understanding as well. This is in order for it to go forward, all 3 towns have to, in this iteration, all 3 towns have to pass.
Right.
Okay, good. And the only other thing, and I know David Young has discussed this with us several times, is my uncomfortableness with the fact that the devil's in the details always with the golf course, you know, all those items about you know, lost revenues or whatever are not captured here, and we're told they can't be captured here. They need to be captured in a side agreement after this has been enacted. So, you know, that's really I don't know. I know he talked to us once before about that particular item. We won't know what that looks like at all until the board is constituted and they work on that agreement. So I think to the best.
Well, Tracy, I think one of the things that benefits Yarmouth is the fact that there are 2 towns that are in the same boat on that situation. It's not just one town bearing that burden, but there are actually 2 towns that will be impacted by that. So I think at least 2 communities will be making sure that their collective interests are addressed. And at least in the discussions that we've had so far, I've heard nothing that would concern me that there'd be a lack of sensitivity in terms of what needs to be addressed. So, Dan, is there a point I'm missing here, or is that a fair characterization?
No, that's correct.
Okay.
All set. Thank you. Sorry, had to deal with the cleaners for a moment there.
Cleaners, yeah, very good.
No, there are details, and unfortunately that you know, you have to sit your commissioners that'll be doing a lot of the negotiating. But to Mark's point, there was definitely agreement that you know, we have to get it right with our concern with Bass River, because the other town has their issues coming up on the same type of situation. So I'm concurrent with Mark on that thought.
That's good. Very good. Are there any other comments on the motion?
Mr. Chairman, I just comment that the savings that are potentially realized with this DHY agreement just make this the wisest move that we can make for our taxpayers moving forward. And as far as relationships with neighboring towns, I, for one, am in a position where I really am ready to turn the page and enter into a new relationship with Dennis, a positive, functional, friendly relationship where we help each other out and work for common causes. We've been held up with a strained relationship for over 20 years now. It's time to put that behind us. And this agreement gives us that opportunity, and it helps the taxpayers of both towns, all 3 towns when you include Harwich. But it also, I think, significantly just turns the page as far as we're concerned. trust Dennis and to make this project as economically feasible as we can moving forward. So I'm very, very happy with the agreement. I think it protects all of our interests. It gives us recourse if there's any disagreements. And yes, there are details that still need to be worked out, but the sentiments and the willingness of the parties to work together thus far have only encouraged me that we're going to be able to do this successfully. It's based on a model that came from another town that seemed to have even worse relationships than we do. And they have done very, very well. And it seems to me that it's time for us to put the past behind us and to move forward and to work with Dennis and with Howard and get this done.
Okay. Thank you, Dan. Any other comments or questions on the motion? Hearing none, I'm going to ask for a roll call vote. Dan Horgan.
Aye.
Mike Stone.
Aye.
Tracy Post.
Aye.
Eric Tolley.
Aye.
Mark Forrest, the chairman, votes aye as well. It's unanimous. Thank you, everybody. So let's move on to the next item on the agenda. We're a little bit behind schedule. Oops. And it's for the budget presentation, FY22. And we're going to get Ed Centio set up here with his presentation. Is that correct, Pat?
Yeah, Ed has
Okay, so he'll be setting that up now.
Okay, I sent out with the budget documents memo summarizing based off of the budget policy directive that the board voted in October. There are a few slight variances. What I would say as Ed goes into the presentation is the track for this budget probably going to be very similar to what it was this past year. And I would encourage the board to keep your options open as it relates to all available funds needed to ensure that the budget is balanced and keep the town moving forward. So that being said, if Ed is ready, the PowerPoint gives you a good overview of where we're at. So,
thanks, Dan. Ed, are you ready?
Yes, I am. Are you ready?
Yes, we are.
Right.
We'll tackle another challenge.
Yeah, as you saw in Dan's memo, this is the draft. This is the start of the process. There's a lot of information that we still don't know. Mary Alice and Pam and Maria Ruseva, our town accountant, had to do some scrambling based on some information that we received from Barnstable County for retirement. So, you know, this is going to be an evolutionary document or evolutionary process until we get some final numbers where we can go forward. I'm just going to go over some highlights. We have attempted to fund items as normal, albeit not all in the levy for capital. And we see the board and the committees removing items as desired to be more conservative. And I also want to make a note that the departments put a lot of work into the budget. They were also very restrained in terms of the types of things that they may have normally asked for in a different different climate, and you know, that took a lot of pressure off, I believe, capital budget and some of the other folks. But you know, there are challenges that we have to deal with that I think the department heads and staff all realize. Our original intention, obviously, was to take all the short-term rental receipts and set those aside for the clean water pre-funding and funding. And I think we're going to have, I believe, if things continue as they are, you know, some amount of free cash that will accrue at the end of the fiscal year unless we take a serious dip in our funding. So I still think there are pre-funding opportunities that recognize short-term rental receipts going into funding. But to balance this budget, one of the major things that we had to do was utilize $670,000 to help to fund the general fund utilizing these local receipts. We believe there will be over $1 million in short-term rentals, so it won't be all of it. And we have opportunities to cut the budget in many areas. So that's not the end of the story. And we have potentially other funding sources that we can use. So that's not the end of the story. In the first quarter, short-term rental revenues were $855,000 approximately. And hopefully we'll see at the end of December another very big number as it relates to that local receipt as well. We've also taken a little bit more aggressively than we wanted to, taken 10% of the local receipts that we had in 2019. That's the first full fiscal year before the impacts of COVID hit the town. Currently, our local receipts revenues are 94% of 2019, not including short-term rentals. With short-term rentals, we're at 110%. We're looking at obviously providing a balanced budget, and we're looking at level services and contractual increases. There are some level services exceptions for consideration, but again, that all requires a review again by the Board of Selectmen and the FinCom. Education has been provided up to 2.5%. We're going to talk about what some of the issues may be with that percentage. We looked to fund the $1.5 million in routine capital utilizing free cash because it would not fit within the levy. Again, and this was probably our #1 priority. And before we got some of the numbers that we received, we were hoping to get some of the $1.1 million of roadway funding into the budget, but we were not able to. Again, the town meeting voted $1.1 million in an override that would be dedicated to roadway improvements. And also part of that town meeting warrant was the fact that that was to the extent the money was needed to get to a pavement condition index of 70 or more, and we're well above that pavement condition index. And that's because DPW has done a great job utilizing our town funding as well as the Chapter 90 funding. There was also a request to do additional roadway funds based on the increase of those of the roadway funding at 2.5%, and that would represent about $240,000. Again, we've tried to fit that into the free cash items where possible, and obviously increasing by 2.5% is very sensible, but again, that needs to be something that's looked at. In addition, stormwater was included into the budget. Again, not something that was part of the override, but again, something that was sensible. Sidewalks this year represents a brand new spending of $250,000. Again, if we want to do that, we would be looking at free cash. We have some amount, not entirely as much as we need, that we'd be funding from to OPED from our revenue generating entities. One of the things that we did so that we can show the state that we are contributing significant amounts to the library was to ensure that things like custodial services, OPEB, and other items were included in the library. Those would be offset by other reductions, say, for custodial services and facilities. But that shows that within our budget, we are contributing significantly to the library. And we have to do that at the end of the year very quickly amongst all of our other reporting. And we don't always remember all of the different types of things that should be included. So we wanted to include those items in the budget, as we have previously included electricity and heat and all of those other types of things that aren't normally in an individual budget, but this is important for the state aid calculation. There was a request or consideration that was being requested for a new health department staff member, and this is related to the increased workload because of short-term rental registrations. IT services, we're looking at switching some of the services, taking servers that we have in Town Hall, putting those in the cloud. So rather than every 3 to 4 years asking for large investments in hardware and in licensing types of things that need to come with that hardware. We're looking to see if we can try to utilize cloud services and pay for that on an annual basis rather than every 3 to 4 years. DPW staff had been in roadway management funds, which utilized some of those funds for wages as opposed to materials and services. And we're looking to actually move that into the DPW budget away from roadway management if we possibly can. We're looking at overlay reserves to be used to fund the fire truck that was requested. There wasn't enough money to do that funding from free cash. We've done some calculations about where we may be with our overlay reserves. Our assessing department did a fantastic job in the evaluations. We have not gotten very many abatements, and even if we had all those abatements awarded to the customers or the property owners, we would still have room in our overlay reserves, but we're still being conservative. And then in addition, we want to provide to the wastewater effort for the Route 28 mains the ability to borrow $3 million, and we're looking at overlay reserves, at least for the first year, to fund the $100,000 that we think we would have in short-term debt. That debt then, would eventually roll over, hopefully, to the SRF funding at 0%. This is where we have some potential issues. The regional school district, Cape Cod Tech, increased by 22 students. And that we have realized the number for the debt service related to the building, but we're still waiting for what their operating budget may increase to. In addition, hopefully during the closures in March through the end of the fiscal year, they were able to put away significant money so that that money can help with this upcoming budget year, and the increases to us won't be as great. The DY student enrollment shift for 1 year was 154 students. Again, we're being helped by the great agreement that everybody struck in terms of having a 5-year rolling average based on the students, so that won't impact us fully this year, but there may be an impact above or potentially above the 2.5% that we've set aside in the budget. Pension, the pension number went up by 20%. This was based on an email. I'm hoping that was a typo. We should be getting a formal letter from those folks, and this is what we scrambled to update during the day today so that we could provide a balanced budget. But again, I'm hoping that's a typo, and you'll see the actual number going forward. The health insurance rate, again, we don't know what that number is yet, but we put in a placeholder at 10%, general insurance at 10%, and state and county assessments at 2.5% increase. Looking at the free cash information and trying to accommodate spending until folks like the FinCom and Board of Selectmen and perhaps the Capital Budget Committee can re-review these items. We've listed those items that were spent, obviously, on November 17th. We normally try to set aside money for any year-end problems that we may encounter, like snow and ice, and hopefully that won't be major. And then what we did was list all of the capital items that the Capital Budget Committee recommended, including some of their free cash asks. Again, I think we need to take a look at these very closely to ensure that we're funding, just the highest priorities. And maybe what we can do is not utilize all the free cash. And if you look to the right, looking at the free cash summary, we actually have a deficit of $249,000 in money to actually fund these items. And then some of the options to close the gap would be to reduce spending on some or many of these items, we could reappropriate unspent articles if these are a higher priority than what has already been allocated to departments for other spending. And we could also look at capital stabilization, things like golf paying back a small amount of what the general fund provided to them during the lean years. There are a variety of other ways that we can cover $249,000 if all of this spending is in fact definitely required. Just to give you an indication of the different funding sources we have, you'll see amounts for general stabilization, capital stabilization, OPEB, ambulance fire reserves, the retained earnings from the different enterprise funds and special revenue funds. Also pointing out what we have for general fund articles and their available balances. Those would be balances that are not yet encumbered for projects. And just to give you an overall feel for all of the different funds that we have, many are restricted, others are unrestricted, but we have about $22 million in money that we have available, and these items above are included in these numbers. And you are given a list of the different funds and what they consist of in a previous presentation. To take a look at how we compute what we can fit within the levy, we take our last year's information, come up with what that levy limit was. Then we add 2.5%, the Proposition 2.5 amount to it. We estimate a new growth estimate. Normally I wouldn't go this high, but we estimate that. So that gives it around $1.92 million in additional spending that we can provide for within the levy. To show some of the challenges of some of the items that we have to fund, again, this is a huge number for the pension assessment, and I'm hoping that that's something that we're going to get a different amount for when we get the letter. And we also have some issues with, some of the folks that, the Gannons and the Vanessas that we rightfully should be funding because we went outside of the retirement mechanism for them. DUI, we funded at 2.5%. That's $896,000. Again, we're looking at 154 additional students. We have to see what that impact is going to be to us. And then we have the other lists of health insurance and Cape Cod Tech and some of the other key items that we tried to fit within the budget. Then just to give you an idea, there was a question earlier today, how would we arrive at, some of the funding that we would need to utilize for wastewater. This was something that was in a presentation to you last year as well. So we're looking at short-term rentals at some point in time. Hopefully the economy irons out and our other local receipts iron out so that, at least beginning in FY22 or FY23, these would be recurring dollars that we can put into that fund. Then we have the idea of taking a host fee from the septic facility and contributing up to $1 million, and then we can reassess and see if the septic facility can spin off any other money. And then the Cape Cod Energy Park phases 1 and 2 look very promising if everybody's agreeable to the process that's going to be done, including a upfront charge of revenue of $150,000 that could hit us in FY22. And by hit us, money that would go into our receipts. And then we have the WIF vote for $500,000, excuse me. And then we have a list of several other revenue sources that we're hoping will bear out. And just looking at the recurring funds, we can leverage that amount of money to about $60 million in funding, given that we'll get a no interest SRF loan. So we're building on the dollars that we need to build on to get to that $130,000, and I think we can come pretty close, if not exceed that amount of money. And any questions, or would the board like to discuss any of these things?
Very good. Let me go around. Thank you, Ed. Let me go around to the board members to see if they have any questions. I'm going to start at what I would say the other end of the table with Eric. Eric, do you have any questions, comments?
Thank you, Ed, for all the hard work. Is this something that can be emailed to us? I still
Absolutely.
my brain isn't able to absorb slides being flipped through quickly. I still like to print these things out and take some time to go through them on paper. So again, on the surface, it's fine, but I still want to be able to take a closer look at it.
Yeah, we'll get that to you immediately.
Thank you. That's all I have, Mr. Chairman.
This also goes along with your budget book as well.
Okay.
That you'll be receiving.
Okay, Ed. Tracy?
Well, thank you, Ed. This, I know it's a sign of the times, and we've been here before. We're going to have some hard decisions to make, clearly. It's unfortunate that, we're not going to be able to put the capital back in the levy again. I'm concerned about the use of the short-term rental funding. I know this board didn't want to make a policy decision about that. And now it's going to be used for something else. So we're going to be impacting our wastewater plan, I believe, based on what you presented. Is that correct, Ed?
Unless we find cuts otherwise. So there's an opportunity not to use that money if we actually lower the amounts of money that are within the levy.
So has the Cape Cod Municipal Health Group taken a vote yet in terms of, I know last year we benefited significantly from their vote of no increase on health insurance. When will we know that?
They went up for the retiree health insurance, the Medicare type options, Medicare supplemental type options by 8%.
So the projection that you've given us is accurate.
I wouldn't say it's accurate. I think we're still waiting and hopeful.
Yes. I saw on one of your slides, you talked about a $54,000 energy increase. That always perplexes me with all the work in solar that we continue to do and the savings that we're told. And every year, the budget increases for energy.
We usually just put in 10% over at this early stage for planning purposes. And then as the year unwinds, we do a little bit more analysis, and it typically goes down significantly. It's one of those last areas we try to touch because you never want to run short on utilities.
Okay. Well, one of the slides that you had talked about the golf. Can golf afford to pay us back and capture the deficit, the delta? I believe they owe us $264 for 1 year. Plus, I think
it's like 360 altogether, thereabouts, maybe.
And do they have that at this point in time?
I wouldn't do the whole
kind of a tenuous terrain here, but I do believe that COVID helped them out tremendously. I would anticipate our situation, if it stays the same, golf will be really popular again next year. There probably is, I know you have to be careful as it relates to the chargeback, but there could be some room to have that conversation.
All right. Well, I mean, we're early stages. I think that hopefully this will start to look better. I really think that we needed to find a way to get the capital back in the levy.
And we can
sure how we could. I'm sorry, say that again?
We can still do that, some of it with budget cuts, if that's the way you would like to go.
Well, I mean, I think that this is going to be a constant issue of we work so hard to get that in there. And I think, we know that it's something that's needed, and we put that off. I see we have it here through free cash. I don't know. I think it's just going to have to massage its way out as this thing goes forward. But I am concerned about that. I'm concerned about the use of the short-term rental funds being used for anything other than the wastewater as we predicted. I guess I really don't have any other questions right now.
Okay, thanks, Tracy. Mike?
Can you unmute Mike, Pat?
Not until Ed gets out of there.
Now,
Is that Mike?
hello?
Yep, we got you.
Okay. First of all, I'd like to share Tracy's concern about the diversion of rental revenue receipts that were earmarked for the wastewater project. I understand that what you're saying, and it may have to be that way in the short term, but if there is another way, I would like to start building that fund out of those revenues. And I think the approach that the board wanted to take was to devote 100% of the short-term rental receipts to the wastewater project. So that is a concern. Capital going back into the levy again is another problem area, but again, I understand that there has to be flexibility at this point in time. We'll have to see how that shakes out with the budgets for the various departments. The question that I have pertains to the assessment from the Barnstable County Retirement Board, a 20% increase. Two questions. Is that a hard number at this point? And number two, that seems to be a rather large increase. Is it? And if so, why is it so large?
We will get the detail of what that consists of in several days, I believe. They usually send out a memo with the detail to the different towns. It seems way out of line with prior increases. I'm going to close the door. I'm going to deal with the cleaning people as well. Hold on. Sorry about that. So I absolutely, it really seems like a typo, and we're going to push back on that and really try to get underneath why that number is what it is. But that was an email based on a request so that we could have that number for this presentation. I originally put in a 6% increase. So it seems really out of line with what hopefully reality is.
Have you done any just rough calculations with respect to the increased number of students in the DY school district in light of the amendment, with the mechanism of the 5-year rolling average put into the modified agreement to soften the blow of any significant increases of students in any one fiscal year? Do you have any just rough numbers as to what that increase may represent in terms of dollars?
For years, we used to calculate that or try to calculate that. We were always way off. It always depends on what the school's budget comes in at. Is their overall spending going to increase by more than 2.5%, or are they going to stay within the constraints of 2.5%? That's going to drive all of this. So, we have, again, for 6-7 years tried to do that computation, and we're always way off.
Okay. I guess that's it for now. I'd just like to hear Eric's thought about the PowerPoint presentation. My brain works similarly to his, and I would like to see that as well. Thank you.
Yeah, I'm assuming, Ed, you're going to send that to the entire board, right?
Absolutely. I'll send it tonight.
That'll be great. Yeah, and I think there's a lot of information here rather than trying to squeeze out every
right
night. I think it's something soon we'll want to revisit some of this. So keep your powder dry. Dan, any comment?
Sure. this is a first brush for the budget. It's sobering. Like Tracy, I have very little appetite for diverting the short-term rentals from the wastewater at this point. We recognize what a large commitment we have ahead of us, and it's just setting the wrong tone right out of the gate to be diverting funds from that, regardless of the circumstances. And obviously, we have lots of different issues coming together here at once. The costs of a new school, the increase in students, the decrease in revenue. We have difficult decisions that we're going to have to make going forward. But Ed, thanks so much to you and to your staff for putting all this together, and look forward to working with you in the coming months to see if we can figure this out. Thank you.
Okay, thanks, Dan. Well, I'd just like to make a few comments real quick. You know, we can't lose sight of the fact that we're in this COVID environment, and one of the things that's being debated in Washington right now is how much aid is going to come back to states and localities to provide help. We haven't really sort of looked at if there's an absence of aid, the kind of ripple effects that will play out. I know the schools, all schools, not just ours, but all schools are being impacted by COVID in a significant way. And at some point, we need that federal help.
Mark, you're a little muffled.
There's not much that I can do about it.
That's better.
That better? Yeah, no, I'm just very concerned about the financial package to help states and localities deal with COVID. We need that help. And unless we see some action soon, it's going to begin to have ripple effects in terms of the budget cycle. You know, we can make assessments and assumptions on what we might be able to get from the state, but some of that's based on getting help. And hopefully, you know, for a Christmas present, you know, in the upcoming aid package that's being negotiated, you know, we'll get some relief, we'll get some help. And that's why I'm an I've been very supportive of short-term rental dollars being used for wastewater, but in this emergency situation that we're dealing with, I do think the flexibility that's built into this, you know, actually is a huge asset for us. I'd like to think that the financial uncertainties associated with COVID will become settled, you know, within the year, and that we'll be in a position soon to sort of set aside, you know, the requisite dollars that are necessary. But I'm sort of on the different side on this one. I like the flexibility for those short-term rental dollars for this fiscal year. And like I said, I've been very supportive in the past, but right now I think we need as much flexibility as we can find. So I'm very happy with that. But like Eric, I'd like to spend some more time digesting this. And I think as a board, we need to find some time to once again take another look at this. But after we've had a chance to review some of the numbers, and then we can come back to Dan and to Ed and talk a little bit more. So I think for now, unless there are any other comments, I'd like to leave this part of the discussion. I don't know, Dan, if you have any parting comments before we move off of the budget.
No, I think it would be accurate to say this is the beginning of a very long process, and we'll know more as the year unfolds. And I would just encourage the board to remain flexible. There are, as Ed pointed out towards the end, there's a variety of different options that you could entrust administration to go down that could soften the blow, and I think also to preserve that short-term rental revenue, but those do require the board to make those decisions to give whatever administration comes after me the directive to get that done. So the clearer that directive can come, the sooner we can start working on that and get you better options.
Very good, thank you. Okay, the next item on the agenda is the spring annual town meeting article review. You all have that one pager in your packets. I'm going to turn this over to Dan for his commentary.
Yeah, so thank you, Mr. Chairman. I would add right now, I do know that we need to add an item probably just after number 8, water capital. But this did go to the staff. They have given the feedback as to what are the likely articles for town meeting. And I think obviously having the flexibility of a fall town meeting is incredibly helpful for kind of keeping the warrant, under maybe 30 articles, say. I do want to put in your mind that potentially you might want to consider doing what we did last year, if the COVID situation stays as robust as it's been, or even a little bit less, the flexibility to do an outdoor town meeting. I had quite a discussion today with town council about how successful, in fact, tonight, he's in an outdoor town meeting tonight in one of the towns he represents. So I do know that if we give it a little bit more time towards the warmer month, we probably would have better testing results. But I think, in the environment that we've seen or we've been in, to think that you're going to get more than 150 or 125 people at a town meeting in an indoor environment in April is probably going to be a hard thing to sell on people. I get the sense that even with the news about the vaccination, I don't see a lot of change in people's personal choices as it relates to coming out into the public. But that's how we see things right now. The last date for a citizen's petition article is January 5th. So this will appear again at the January 12th meeting, and you'll need to take a vote on the 26th of January to close the warrant. So that's the schedule that's in front of you.
Any comments, questions? Tracy?
No, I think Dan's right. I think we have to look towards outside. I know we talked about it a little bit last time, and the board was a little bit hesitant about it, but it was very successful in a lot of the other communities here for their April timeframe. Obviously, our last one wouldn't have worked very well currently, but when the weather's good, I think it's important to be outside as much as possible.
I would agree. I attended
I did
town meeting and the Truro annual town meeting, and those were done very successfully.
I didn't see any zoning.
Yeah, I checked in with Karen Green on that because I didn't see any either. And right now there is apparently no zoning in front of us. That could change, but it'll have to change soon.
Good point. Anything else, Tracy?
Nope.
Eric?
He needs to be unmuted, I think.
Yeah, he does.
Yeah. Zoom has taken over.
Thank you. I muted myself to sneeze and I couldn't unmute myself. So thank you. I don't have any questions.
Okay, thanks. All right, Dan.
No questions. Thank you.
That's good. Mike?
I think the only thing, I don't have any questions. The only comment I would make is consistent with what you and Tracy were talking about. We really ought to start thinking about alternatives to indoor meetings. And, we've gotten away with it so far, but as the health folks pointed out tonight, the rate of infection is increased since this thing started. So I think it's all the more imperative that we look at the alternative of an outdoor meeting.
Yeah, I think that's a good point. All right. Anything else on spring annual town meeting article review? Okay. Dan, do you need any more direction from us, or you're all?
We're good for now. Thank you.
Good. The school committee, the open position. This was on the agenda just in case we had to deal with any other matters related to this, but I'm glad everything's gone smooth. Tracy's been sworn in, and we have an interim appointment all squared away. Dan, can you tell us about the upcoming candidates and interviews, and just to recap for us what we're going to do at our next meeting or two?
Thank you, Mr. Chairman. So at this point, as you're all aware, we have 3 candidates that have come forward. We still have about 2 weeks. We set a December 29th cap for letters of interest and resumes to be sent to Pam Barnes at the town hall offices. So we have 3 currently. The idea is to, at our January 12th meeting, to conduct interviews. And I want to throw out to the board exactly what kind of process you want to follow. I think ideally we probably want to agree upon a certain set of questions to be asked of all of the candidates, and then provide some time for any individual questions that any of you might have for any one particular candidate. So if you have suggestions as to what general questions should be asked of everybody, I'd appreciate if you could send them to me so that I can distribute them in time for our January 12th meeting. And then the other thing, Mr. Chairman, that we need to consider is just time. How much time do we need to allot for the interview process? I would think at least an hour, if not an hour and a half, with 3 candidates. And it's possible we may have more, but that's what I envision at this point, and I'm open to any other opinions or comments from the board as to how to proceed from here.
That's great, Dan. Thank you. Anybody have any suggestions? Mike?
Well, last time we did it, in the interest of time, we did a group interview. I don't recall, it was like 3 or 4. I don't think there was any more than that. My memory is maybe about 3. And we did have some common questions, although we allowed a little bit of diversion because people's backgrounds, there may be something unique in a person's background that you may want to ask them about. We do the same thing with the town administrator questions. I mean, there's some questions that are kind of stock questions, but then each candidate usually comes before you with a different background, a different perspective on things. And, we don't want to lock people into rote questions and not be able to really explore what's on that particular person's mind or what they bring to the table. So I would say you follow that format like we have done before, and we've deliberated and actually made the appointment at the same time. Now, in the best of all possible worlds, it would be great to schedule them out, separately, but I don't think we're going to have time to do that.
Okay.
I'm looking at it from more of a pragmatic approach, really.
Let me ask the board if there's a comfort level with interviewing and voting on the same night. Tracy, any thoughts about that?
I guess I'm just concerned we have 2 more weeks for applicants. And I think, at what number, perhaps it stays at 3, that's fine to interview all 3 of them. But if it gets to a number of 7 or 8, what will the process then be in terms of what we do? I guess we can cross that bridge if we get to it. But I'm not sure it'd be productive to interview 8 people or 10 people.
I think the appointments chair is looking for suggestions. So if you have any thoughts specifically on how to deal with that, we don't have to discuss this at length tonight.
Well, I guess, I don't know, that's always been a decision that the board as a whole has made because it's never been an appointments chair appointment. So I just think that the board should discuss how that goes, if that's the case.
I guess what I'm doing is looking for recommendations in terms of
My good Mr. Chairman, if Tracy's scenario unfolded and I agree with her, 3 max 4 you could do, but if you had 6 or 7, you'd probably have to do it on 2 different nights.
Okay.
I mean, I'm comfortable making a recommendation after an interview.
Okay. So we could do is if we end up with a handful of candidates, we could do it on that night. But if it's more than 3, more than 4, move it over to 2 nights.
Yeah, I think we'd need to cap it at 4. Otherwise, you'd really dominate the meeting and knock out some of the other topics that you have on the agenda.
Eric, any thoughts?
I don't have any specific thoughts as to how to deal with the potential numbers. I think 3 is manageable. When we did this in 2010, we had 2, and we made the vote immediately following the interviews. When we did it a few years ago, I think there were 3. And I don't recall whether or not the appointment was made immediately following, but I tend to think that it was. So, my tendency would be is if we do have only a handful to make the decision immediately that night. And Mike was correct that in the past, this has been done kind of as a group interview. It wasn't one at a time. When we were in person, I believe that all the candidates were sitting at the table at the same time. And, we went right down the line with questions, similar to the way candidates night works. So, same question to each candidate and kind of an on-the-spot evaluation and decision. So, that would be my preference rather than hopefully we won't have to drag it out for 2 meetings because of numbers, but we certainly shouldn't have to drag it out for 2 meetings in order to make a decision. So those are my thoughts based on past experience.
No, those are great suggestions. Tracy, you support that, what Eric has laid out?
Yeah, like I said, my only concern is if we get a large number, we may have to reevaluate what our process is. Because
if anybody has any suggested stock questions that each of the candidates should be asked, I'd appreciate if you could forward them, just so that we're all working from the same page. And I'll let you know if any other applications come in, and we can deal with them as they come.
That would be great. Anything else, Dan? You all set?
Not on the school committee position.
I think the last time we did it too, we each had our own question that we asked. We went around, there were 5 questions, one asked by each member, and then as you discussed, there was a kind of a free flow follow-up from that, but each one of us asked one question.
That sounds like a good idea.
Great, very good. Okay. Unless there's any other points to discuss with respect to that topic, I'm going to move on to boards and committee actions. And I'm going to ask our appointments chair to bring before us any resignations we need to act on.
Thank you, Mr. Chairman. The first thing I bring before you is a letter of resignation from our representative to the Tony Kent Ice Arena. It's actually Tony Kent, and I'd like to recommend that we accept with great appreciation his resignation.
So moved.
Second.
All those in favor?
Aye.
Aye.
Okay, roll call, Mr. Chairman.
Oh, okay. Mark Forrest, aye.
Tracy?
Aye.
Eric?
Aye, and I would just like to say I sat with Tony. I used to be on this board, and Tony has given a lot of his life and a lot of his time to this facility, and the 2 communities should be forever grateful for all the time that he's spent on this. So aye.
Thank you, Eric. Mike?
Aye.
And I'm aye.
Unanimous.
Okay, that brings us to appointments for open space. I'd recommend Christine Brantley and Beth Conway to appoint them to the Open Space Committee. The appointments are for 2-year terms, which will run through December 31, 2022.
Dan, can I ask a question on that?
Sure.
I don't know if the Open Space Committee meets year-round, but it appears that Ms. Brantley is a part-time resident.
No, she's full-time now.
Okay. All right, thank you.
So do I have a motion to appoint?
So moved.
Second.
All those in favor, roll call.
Call the roll.
Mark is aye. Tracy?
Aye.
Mike? I'll take that as aye. Eric?
Aye.
And I'm aye. Thank you. That will bring us down to, let's see.
Committee reappointments.
Hold on one second. I'd have a reappointment to the Barnstable Municipal Airport Commission. The recommendation is to reappoint Dr. William Marasco as the Town of Yarmouth's representative to the Airport Commission. The appointment is for a 3-year term, which will run through December 31, 2023.
So moved.
There's a
Second.
motion is made. Is there a second?
I'll second it.
Any comments? Selectman Post?
Aye.
Selectman Forrest?
Aye.
Selectman Stone?
Aye.
Selectman Tully?
Aye.
And I am aye. Unanimous. That brings us to the reappointment of Stephen O'Neill to the Community Economic Development Committee. My recommendation is to reappoint Mr. O'Neill to a regular position on the town's Community Economic Development Committee. The appointment is to run for a 3-year term, which will run through July 31st, 2023.
So
Can I get a
moved.
motion?
So moved.
Second.
And seconded. Selectman Post?
Aye.
Selectman Forrest?
Aye.
Selectman Stone?
Aye.
Selectman Tully?
Aye.
And I am aye. Unanimous. That brings us down to the reappointments for the Open Space Committee, and I'm recommending that we reappoint Ms. McElroy and Mr. Senecal to the Open Space Committee. The appointments are for 3-year terms, which will run through December 31, 2023.
So moved.
Second.
All those in favor, Tracy,
Aye.
Mark,
Aye.
Mike,
Aye.
Eric,
Aye.
and I'm aye. Unanimous. And that brings us down to the Barnstable County Wastewater Collaborative. I'm making a recommendation to appoint Mr. Jeff Colby as the Town of Yarmouth's representative for the Barnstable County Wastewater Protection Collaborative. The appointment is for a 1-year term, which will run through December 31, 2021.
So moved.
Second.
Second.
Tracy,
Aye.
Mark,
Aye.
Mike. Was that an aye?
Yeah.
Mike?
Yes. Aye.
Eric?
Aye.
And I'm aye, unanimous. And now the Barnstable County Transportation Committee, I make a recommendation to reappoint Mr. Colby, Mr. Jeff Colby as the Town of Yarmouth's representative to the Barnstable County Transportation Committee. The appointment's to run for a 1-year term, which will run through December 31, 2021.
So moved.
Second.
Second.
Okay, Selectman Stone,
Aye.
Selectman Tully,
Aye.
Selectman Post,
Aye.
Selectman Forrest,
Aye.
and I am aye, unanimous. That completes the business for this evening, Mr. Chairman.
Okay, thank you, Dan. Well done. Okay, next item on the agenda under board and committee actions is an update from the Town Administrator Search Committee. I'm going to ask Mr. Stone and or Mr. Tolley if they'd like to update us on how they're doing.
Mr. Tully will defer to Mr. Stone.
Why did I anticipate that? We have 4 interviews scheduled this week. 1 for tomorrow, 3 for Thursday. And we hope to, depending on the success of those interviews, bring something back to the board either by special meeting this month or early in January. I think, however, Mr. Chairman, in view of where we are with respect to Dan's, the expiration of his contract, we should really start thinking about appointing an interim. I don't know when these other candidates, if they are suitable to be referred to the entire board. I don't know, at this point in time what their schedules would be, but I certainly don't think they're going to, my guess is they will not be available as soon as Dan leaves. There's probably going to be some gap in between Dan's departure and their starting date. So I think we should seriously think about appointing an interim town administrator.
Okay. Any comments, reaction from other board members? Mr. Horgan?
I agree. I think we know we're going to have a lapse between the two periods of time where a new town administrator can come on. I think we really need to take care of this and get somebody into place to make sure that the business of the town gets done.
Okay, thanks, Dan. Tracy?
I mean, I think we have to be prepared, but I mean, perhaps we just don't know at this point in time what could shake out.
I understand. Is there any objection if we as a board designate our town administrator search committee to empower them to broaden their scope a bit to come back with a recommendation on an interim administrator as soon as possible? Is that?
How does that process work?
How would that process work?
Yeah.
We would leave it up to the committee to do outreach on potential interim administrator candidates and come back to the board with a recommendation. So they could conduct their own search and interviews just as they're doing now with the town administrator.
Well, I mean, they're not really conducting their own search. For the town administrator, people put their interests forward. So that's what my question is there a way for people to put their interest in that forward for them to consider, or they just?
That's up to the board to decide. If you feel that that's a position that you would like to post, we can go in that direction.
I'm not sure we need to post it, but I think that there should be, there could potentially be people that have interests that maybe they not aware of, but they wouldn't had originally considered. So I'm just wondering how that works.
So what would you recommend?
Well, perhaps maybe if somebody has an interest, they can send an email to the town administrator's office for their consideration. I mean, they could take it or leave it, but I think that there should be a venue of which, if somebody's watching this or there's an employee within the town that, I don't know, has some interest, that they should be able to be known.
Okay, I'm just looking for suggestions. Dan?
Mr. Chairman, does it make sense where we've got Mike and Eric working on the town administrator search? Does it make sense to perhaps designate two other members from our board to work on the interim position?
I'm open to that. I'm open to anything that the board desires. I have no preferences whatsoever. So, Mike, comments, or Eric, are you willing to take this on? Are you able to take this on? And I guess the comment.
I don't envision any open involved search, because I mean it's be a very limited function that somebody would be performing, and maybe a matter of a few months. I mean, what kind of a response do you think you're going to get for a couple of month position? I think more likely we'd have to recruit someone.
Right. Eric, any thoughts you want to add to this?
I like the idea of designating two other members for this particular piece of the puzzle. That's not to say I couldn't or wouldn't do it. It's time consuming, and Mike and I have already spent a significant amount of time on it, and we'll spend more in the upcoming days, and certainly in the days beyond that. So that's my only thought.
So you support the idea of two others helping lighten the load a little bit?
I would not be opposed to that, no.
Do we have any candidates, two candidates willing to take that on?
I recommend Tracy.
I would do it is the board comfortable? I mean, perhaps we don't get any interest submitted, but is the board comfortable? I guess I'm just not comfortable with hey, how's it going? I don't know. I'm a little bit uncomfortable with that in a fair process. So would the board be comfortable with a very short period of time to say, in the next I know it's the holidays, but within the next week, to email to the town administration your interest for consideration. And like I said, we may or may not, but we may have to recruit somebody. I'm not opposed to doing that if that's, I mean, I think there would have to be some coordination because we don't really know the timeline without the other piece of it.
Well, we already drafted and approved a scope of services for an interim administrator. So we already did that a while ago, back in months ago. So that's already been done.
Mr. Chairman, I'm willing to join Selectman Post, but
Okay.
also I'm absolutely willing to step back and let perhaps yourself and Selectman Post take care of this.
Yeah, no, I understand. I think we're all just interested in following.
Right.
You know, I mean, I'm trying to divide the load and to be helpful and be a resource. So if Tracy, you and Dan want to take this on, and if people have an interest in serving in this capacity, to let you know.
That's fine. And when would you want to answer from us by?
I think a recommendation, I'm just looking at the calendar right now. I think we need to have, if anybody has an interest, they should let us know within the next 2 weeks. And we have, you know, I've certainly heard from people, because I've been an interim administrator and I've been contacted about my availability in other areas. So I know there's a small group of people that might be able to help us out. And I'll forward the people that have contacted me. So I don't know if we need to take a vote on this. But maybe we should, that we appoint Dan Horgan and Tracy Post as the designees to recommend to the full board as interim town administrator. And,
Make that motion.
okay, do I have a second? I'll second it. Any discussion? Hearing none, I'm going to do a roll call on this. Mike Stone?
Aye.
Tracy Post?
Aye.
Eric Tolley?
Aye.
Dan Horgan?
Aye.
And the chair votes aye. Bingo. Okay. Next item on the agenda is meeting minutes for February 25th and March 20th.
Move the minutes.
Second.
Hearing any discussion? None? All those in favor say aye. Roll call vote. I'm going to call a roll. Dan Horgan.
Abstain.
Abstain. Mike Stone.
Aye.
Eric Tolley.
Aye.
Tracy Post.
Aye.
Mark Forrest votes aye. Next item. I'm sorry. Did we act on the March 20th minutes?
I think we did both of them.
Both.
Yeah. Mental cramp here. Sorry about that, folks. Upcoming agenda review. Any items to discuss in terms of upcoming agenda review?
Only that we now have a meeting on the 22nd at 5.
Yes. That is duly noted.
And if I could have one request, Dan, would it be possible to see if the town has a policy or a position that it's drafted with regard to the airport, so that I can review that with Dr. Marasco?
I have a document that was generated the last time there was an airport expansion that the board at the time, I want to say, I just saw it here. It generated its own committee of citizens. It goes back to 3/28/2000. But I don't have a particular policy handy on it, but just take a look at this and let me know what you want, and certainly email me what your thoughts are, and I can see if I can search even further.
Okay, I'll check with Dr. Marasco, and I think Mike was going to work on this with me.
Okay. I'm going to have something to you soon on that, but it's based on anything that's previously drafted.
Okay, moving on. Individual items. Dan, do you have any individual
Thank
items?
you.
Tracy, any individual items?
Yes, there was one thing in our packet. There was a thing shared by the senior center about cards. I believe it's in here. Hold on a second. Well, the Senior Center put out a request for cards to be written to our seniors and dropped off at the Senior Center. Yarmouth Connects. There's information in our packet, but they have a card and letter writing campaign at the Senior Center. The age-friendly community and the DY schools started a local letter and card writing campaign for residents of Yarmouth and nursing home facilities. With your help in writing these letters and cards, or even pictures that you took from around town, we can bring cheer to someone's day to let them know they're being thought about. Please drop them off the filled cards and letters at the mail slot at the Yarmouth Senior Center. So when people are mailing out their cards, they find it in their heart to possibly bring joy to one of our seniors in a nursing facility. And as we heard earlier tonight, some of the facilities aren't allowing visitors. It's a very difficult thing for them and for their families, especially during the holidays. So I just wanted to share that.
Thank you.
Thank you.
Great. Mike, any individual items? Oh,
I'd like to take this.
Okay, now we can hear you.
I'd like to take this opportunity to wish everybody a Merry Christmas and a Happy New Year and Happy Holidays. Thank you.
Amen. Eric?
I have nothing. We will see each other again in a week, so I will send my holiday wishes then.
Thanks, Eric. Appreciate it. Okay, next item on the agenda is the town administrator items. First topic, consent agenda.
On the consent agenda, Mr. Chairman, is I sent a memo earlier about the contract with the United Steelworkers, and also the shellfish regulation changes. Those are also in the consent agenda. If I could have a motion to.
Would you like a motion to accept and approve the consent agenda?
So moved.
Second?
Second.
Okay, we have a motion and a second. Roll call vote. All those in favor, Dan Horgan.
Aye.
Mike Stone.
Aye.
Eric Tolley.
Aye.
Ricky Post.
Aye.
Bill votes aye. It's unanimous.
We're gonna need signatures on that document. If you have any opposition, we could stamp those.
I signed it today.
Pardon? Oh, you signed them today? Yeah. But otherwise, if you wanted to stop in at some point, that they'll be available for
You
signature.
can use my stamp.
Okay, just let me know one way or the other.
Okay.
Do I have a stamp?
I think you do. I think we have one from years ago. It's a little dated, but I think it still works.
So you can, is that a yes, Dan? You can use.
Absolutely.
Eric?
Don't
Yep.
give it to my wife.
Eric is fine. And Mike, are you fine? Yep, that was a yes. So you're all set there, Dan.
Thank you.
Any more updates?
No, I just want to thank the board for all their patience in this past year as we get ready to close the year. This is obviously one of the most challenging times that any generation has had to live through. There's a little bit more to go, but I'm hopeful that the next year will bring a better year. And I'm also hopeful that this is a short-time situation, and sometime in 2022, people will freely return to the Cape and vacation here, and things that we went through the last 18 months or in what's in front of us will have abated and better times for the town. So on that note, I'd also wish good tidings for the holiday season for everybody.
Thank you. Before we move to adjourn, there was a request for the board to release town council's opinion regarding the DY school committee appointment. And normally those legal opinions are confidential and for the board's purposes and its own deliberations. So I just want to put that out there. Is any objection? Obviously, I'd want to find out from town council if there's a concern, but I certainly don't have an objection. Does anybody else have an objection if we make that available? Do you have any objection, Dan, if we were to do that?
Which Dan?
Dan Horgan, Dan Knappich.
I don't, but I would ask, and I did talk to counsel about that. He didn't have an objection. It's at your discretion, and how do you want that to be handled? If it's an individual email request or
right.
Publicly, it's up to you as to how that would go.
Yeah, I guess the way I would recommend is that if we have an individual request, that it would be available for that individual. Now, Dan Knappich, your screen froze up there for a second.
That would be a good course to follow. Yes.
Dan Horgan, any objection?
No, I'm a little concerned about the precedent it sets, but no.
Yeah, I think the concern we heard during public statements tonight, and I just want to make sure that I didn't see anything. I thought town council gave us a pretty straightforward opinion. That I have no objection to making that available.
Well, with that question, though, there was an opinion from town council prior to, I think, Bruce Gilmore that rendered on the same topic. So would you want that correspondence to be released as well?
Well, this is the one that we use to base our decision and our recommendation. So I would just have this one available.
No, the point well taken, except for the fact that this isn't like this was new terrain for the town,
Mm-hmm. Well, I've been asked for this one, so that's what this point is about. So if they want another one, then they should make a request, and then we should take it up, and then I should poll the board on their views on it.
That's fine.
So, okay. So there's no objection. Okay, very good. Do I have a motion to adjourn?
So moved.
Second.
Merry Christmas.
All those in favor? Aye. Roll call vote. Tracy Post.
Aye.
Eric Trolley.
Aye.
Ian Horgan.
Aye.
Mike Stone.
We can't hear you.
He's muted again. Just say yes. Just nod your head, Mike.
Aye.
All right. Chair votes aye. It's unanimous. All right, everybody. We're adjourned. Thank you. Have a nice night.